Bionano Genomics just signed a contract with one of the biggest hospitals in the UK, okay, Belfast Health and Social Care Trust. They have about four main hospitals and they have about seven well-being and treatment centers in the United Kingdom. And they are now one of our customers that will be bringing us more money. We are talking about hundreds of thousands of pounds. In this video, we are going to be taking a look at the new contract that Bionano Genomics just signed with this hospital and how this is going to benefit the stock price of Bngo in the short and in the long term. Right after the intro. What up investors, it's your boy Dayo. Welcome to Frunkla Investment, where I talk about Bionano Genomics on a daily basis. From Sunday to Sunday, I try to post at least one video. If you would love to learn more about Bionano Genomics, this channel is for you, okay? Feel free to subscribe to this channel, join other members of Bionano Genomics, those that are also invested in this company, and come here on a daily basis to learn more about their investment in this company. Whatever I show you in this video is just for educational purpose only. The financial market is a very dangerous place and you can lose a lot of money. Always do your own due diligence. Don't sue me, bro. Let's get to it. Alright guys, so this is Belfast Health and Social Care Trust. Caring, supporting, improving together. This is something that is a company based in the United Kingdom. They have four main hospitals. The first one is the Royal Hospitals. The second one is the Belfast City Hospital. The third one is the Mater Hospital. And the fourth one is the Musgrave Park Hospital. And then they have, seven well-being and treatment centers, I believe, where they care for, perhaps adults, those that are sick, those that are suffering from rare genetic disease, for example, cancer, heme malignancies, and so on and so forth. And then we have, these seven well-being and treatment centers: Aki Center, Beach Hall, Bradbury Center, Carlisle, and so on and so forth. Now, they just signed an agreement with Bionano Genomics, a contract whereby I believe they just acquired at least two Sapphire devices that they are going to be using to analyze genomes of patients that are probably suffering from rare genetic disease or perhaps cancer and so on and so forth. So that is what we are going to be taking a look at in the next page. But before we continue, now let's quickly take a look at their website and some of the services that they provide. Look at that: hospital services, okay, cancer services. Now let's go to these cancer services since it is related to Bionano Genomics, okay. Now this is Belfast. Belfast Trust provides specialist services for cancer diagnosis, treatment, research, and education. Our cancer services include all the health and social care services needed to diagnose, treat, and care for people affected by cancer. These services are provided in range of different places, including GP surgeries, district hospitals, specialist hospitals, patients' own homes. So you can see that the trust is part of an innovative partnership with Cancer Research UK, Queen's University Belfast, and Health. Don't let us go too deep, okay. So that is one of the services that these hospitals, this hospital provides. And of course, they have four main hospitals. So this is a wonderful news for Bionano Genomics, because these kind of hospitals, for sure, they are taking care of thousands of patients suffering from cancers, for example. So this is going to mean huge revenue for Bionano Genomics. Of course, they are also into some other stuff, okay. These are the list of their locations: Royal Victory Hospitals, and so on and so forth. So now let's go into what they are doing with the Sapphire device and the advantages of this kind of huge hospital adopting the Sapphire device. Perhaps this is not their first time, but this is the first time we have evidence of them signing a contract with Bionano Genomics. Perhaps they are already piloting the Sapphire device, okay. So nobody knows. This is just what we have for now. Let's dive into it. So the advantage of this kind of contract is other hospitals out there that are taking care of patients that are suffering from cancer patients. When they see something like this, they are going to be like, okay, I think it is time for us also to adopt the Sapphire device, since this device is able to find rare genetic diseases, cause of all these diseases, something that other technologies are unable to find. perhaps it is time for us also to adopt the Sapphire device. That is, of course, one of the advantages of all these big hospitals, going after the Sapphire devices, because it is better than sequencing technology in some, analysis. Now, this is the title. It says Sapphire Bionano System, Bionano Genomics, a contract award notice by Belfast Health and Social Care Trust. Okay. Now, if you go down a little bit, you can see that the duration is not specified. Okay, sometimes whenever they sign this kind of contract, perhaps it's just for 2 years, but this one is not specified. Okay, perhaps this is going to be something that is going to continue, into the, I don't know, in the next 5-10 years. Perhaps they are still going to have this contract, or perhaps they'll just be renewing it every year. Now, this is a contract that is valued at £300,000. I believe one Sapphire device costs about 150,000 US dollars, perhaps in pounds also. So this is more or less like two Sapphire devices. Okay, nobody knows, no details about that. The concept is Sapphire Bionano System, Belfast Precision Equipment, Bionano Genomics Laboratory, and okay, so this is Sapphire device that they just bought. So that means they bought two Sapphire devices, in my opinion. Okay, I'm not really 100% sure about that, because this is a contract. Perhaps Bionano Genomics has reduced the price of the Sapphire device. Nobody knows. Perhaps they increased it. Nobody knows. So now it goes further. It says, you guys can see right here, this tender has been awarded. Okay, this is a contract that has already been awarded. The history is from the 18th of January 2022. Contract award noticed scientific equipment. Okay, now if you go down further, you guys can see that they made some powerful statements. Okay, and this is the kind of thing that I always try to share on my channel, because I believe the Sapphire device is superior, and it's going to replace all these old school outdated tools or methods of analyzing genomes for structural variations. That is what I preach on this channel on a daily basis. Okay, now you guys can see right here, they said the reason why they the legal justification of them acquiring this device is because no other reasonable alternative exists, okay, for this procurement, as this service is essential to patient care and service delivery. Now they go further, and says they said this is a highly specialized element of the service. Okay, and this system is capable of analyzing genomes of the complexity and size of the human genome, providing the required diagnostic utility. Okay, these are two powerful statements made by this. If you see an hospital out there saying this about the Sapphire device, it means this device is essential to their service. Okay, and this device is going to help them significantly. It's going to have an impact, a huge impact on patient care. Okay, and the trust the trust ability to deliver services. Okay, now they went further, and they made a comment about how C19 is affecting their business and blah blah blah. And now they went ahead and they said a replacement in this short term is not reasonable alternative, as it would require extensive and robust validation and verification work that would result in significant disruption and disproportionate technical difficulties. Okay, that would significantly impact on patient care and the trust ability to deliver services. Okay, now that is all information we have for now. So this is a new Sapphire device user out there. Two Sapphire devices, £300,000. Okay, that's a lot of money, and of course not including consumables, because they need consumables. Okay, they need the Bionano Genomics chip, which of course means they are still going to be spending at least hundreds of thousands of US dollars for these consumables, because you need the consumables to put the samples and then to analyze it in the device and so on and so forth. And perhaps maybe they also acquire the NX Clinical. You guys have to understand that we are now selling the NX Clinical along with the Sapphire device. Okay, which they are going to be using, okay, to get the data out. And of course, if they want to complement the Sapphire device with other devices out there, perhaps from Illumina Novasec 6000, they could at least use NS Clinical to gather all this information together. No details about it. Hopefully during the fourth quarter earnings call, Bionano Genomics is going to perhaps say something about this. But this, in my opinion, is a breaking news, and it's a big news. and we are just getting started. Let me know what you guys think about this in the comment section, and of course I read all your comments. So if you are new on this channel, consider subscribing. This is what we do on a daily basis on this channel. I bring the breaking news to you guys, break it down, so that some of you guys that are finding it difficult to understand what is going on in the genomic sector can at least understand it. Okay, I remain your boy Dayo. This is Frunkla. Ciao, ciao.